For the bottom line, we turn now to Chief Washington Correspondent George Stephanopoulos. So, George, as Jake was saying, this is really pulling out the biggest stop the president had. The last time it happened was 2001.
2001, after the 9/11 attacks, and of course that healthcare speech by President Clinton back in 1993. But that speech was at the very beginning of the healthcare process. This is much more the beginning of the end game for President Obama. And as David Gergen said in Jake's piece, right now the president has to reassure the public, inspire and galvanize Democrats, and also intimidate Republicans a little bit, make sure they understand the consequences of failure.
It's a lot to get done in one night, one speech. But let me ask you, 2/3 of Americans still say they are confused about the health care plan, understandably. And the president has given, by our calculation, 27 speeches already about it. What will be different?
A lot will be different. The president is going to give more specifics than he's ever given before. Basically lay out the building blocks of a plan. It'll include 2 or 3 important things. Number one, a requirement that every American buy health insurance with subsidies for the poorest Americans to help pay for them. Number 2, the White House is going to look at these relatively popular insurance reforms. You can't be denied insurance if you have a pre-existing condition. You can't lose it or have your premiums skyrocket if you get sick. And then the big question is what to do with this public health insurance option.
So much turbulence.
White House recognizes that it probably can't get through the Senate, but they also know there's a lot of support for it in the House. So what they're working on is a plan devised by Maine Senator Olympia Snowe, Republican from Maine, Olympia Snowe, and that would have this public option as a fallback. If the original reforms didn't work to control costs, to get more coverage, you'd have this as a fallback. But there is no guarantee that that can fly either.
So in many ways, he'll be speaking to hundreds of millions of people around the country, but also one senator.
You've got that exactly right. Not just the one Republican who looks like she might go for a deal right now, but also this group of about 5 to 10 conservative Democratic senators in the Senate and a group of about 40 to 50 conservatives in the House who aren't on board right now.
And timing has to happen by the end of the year?
That's right. They would like it actually to happen in October, but realistically, Democrats and Republicans I talked to on Capitol Hill say, don't be surprised if we're here right around Christmas.
Okay, George, thanks so much. Good to see you.